Welcome to the Time podcast. You are listening to an interview with Dr. Fabio Piscaglia, President of the European Federation of Societies for Ultrasound in Medicine and Biology. He is also one of the authors of the guidelines and recommendations on the clinical use of ultrasound elastography. Dr. Piscaglia, trying to estimate tissue elasticity or stiffness using ultrasound is not entirely new. Elastography aims to overcome the limitations of palpation and has been rapidly evolving in recent years. So what are the new findings provided by elastography in addition to usual ultrasonography?
Well, using palpation to assess the physical status of a patient has been used since thousands of years. But only recently, this means in the last 12 years, this has become possible by using ultrasonography. The addition of elastography adds a completely new information because conventional ultrasound just shows the images, the morphology, whereas elastography shows the stiffness of the tissue. So this is a totally additional information, and this will complement perfectly a conventional ultrasound examination since it gives new findings. If you could make a similarity, it's just like looking at the abdomen of the patient and then having the possibility of putting a hand on the abdomen itself. You clearly understand this is a much better situation to achieve a diagnosis, not only to look at the patient, but also to put the hands of the patient, which is part of every physical examination. So ultrasonography in these years has become the tool by which we can do this physical examination by improving the capacity of our hands.
Together with a team of experts, the European Federation of Societies for Ultrasound in Medicine and Biology has developed the first guidelines and recommendations on the clinical use of ultrasound elastography. Was there a specific innovation that made these guidelines at this time necessary? And which topics are included in the guidelines?
Elastography is a general term under which there are different techniques which have been developed by different manufacturers to assess tissue stiffness, which means that they do not all provide exactly the same information, but when they are offered to potential customers, they are just promoted as elastography assessment of tissue stiffness. So what EFSUMB realized is that there was a need to provide to each ultrasound operator more detailed information on how each technique was working, so the potential advantages, limitations, the way to perform each of that modality. So this was a very important point at this time. This was not needed 5 or 6 years ago because at that time there was just one or maybe two techniques, so there was not a need to give information. Nowadays, instead, there are several techniques, so it is very important that before anyone goes to use a method, is able to know which information are exactly provided, how this technique should be performed, and this is why we gather this group of experts to give a detailed information. And this makes part one of our guidelines, which are split in two parts. Part one, which is a technical one, background and technical information. And then part two are the clinical recommendations. Currently, we included the information on liver assessment, which is the most widespread, since this has been in the field since more than 10 years, and also has been endorsed by hepatology guidelines. We also included the thyroid assessment, which is also widespread use, the assessment of the breast, of the prostate, of the bowels, of the pancreas, and of the musculoskeletal system. Clearly, the amount of evidence is different in these different organs, but we felt that for all these organs it was already a ripe time to provide some recommendations. But for sure, in the next few years, we will need updates of these guidelines because There is a huge amount of scientific information published every month, and so updates will be absolutely needed to understand which will be really ready for clinical recommendation and which are instead only some research attempts without any clinical translate for the daily life.
To give a short forecast into the future, what will be the further developments of elastography in your opinion? What are the strengths and where are the limits of this technique?
In my opinion, what is absolutely recommended is to have a three-dimensional assessment of the organ we are investigating. You all know that ultrasonography works as a scan, so you have information on a biplanar approach, and you have to move the transducer to get information of the whole organ. So this means that if you are not on the right position, we might not get the total information that we need. So, for instance, to assess the stiffness of a tumor, nowadays we can only get information on a slice of this tumor. But what we need is information on the whole region of interest. So in my view, three-dimensional elastography will be something which is absolutely needed, and probably most companies are working on that. Another point is to have information which are independent of the operator approach, so it does not depend on how much the operator press or not, or at least there are stronger information on whether the technique has been performed, carried out in the right manner or not. So in my view, these will be the next steps to make the technique as much reliable as possible and as much objective as possible and independent from the operator experience. And looking at the future, one of my intimate feelings that it could help in assessing the response of tumors to treatments, and possibly the wound healing. Some limitations still exist, and probably are difficult to solve, is that when we assess based elastography, we get an information, but indeed we do not always know exactly what is the stiffness of the tissue, because we don't know, we don't have the tissue in hands, because this is inside the body. So sometimes we have an information from the outside, but it's difficult to compare with what it is inside, and maybe elastography can provide better information that we know by now, because we don't have this information yet. Probably we won't have this reference standard in the future. But this is just to show that the field is very interesting, and I'm sure that we'll get many new important information for the management of our patients.
Thank you very much for this interview, Dr. Piscaglia.
Okay, bye-bye.